It's interesting. Okay, so this is an exciting moment for me to introduce to you Miss Christine Sullivan. Miss Christine Sullivan is a young woman who is a recently licensed cosmetologist, but she's here to talk about a chronic condition that she has to deal with, and there are millions of people, in fact, over 7 million men and women who are daily dealing with this particular problem that is of concern for Christine every day, but also she's on a mission. Christine is on a mission to inform and educate people about this chronic condition because it's not well known. It's not enough information. It's information on the websites and internet, and there are people who are dealing with it. But in terms of, you hear about certain conditions like cancer or diabetes, etc., obesity, you don't hear about this one as much. Interstitial cystitis is a painful bladder syndrome. It's a medical condition that affects the urinary tract. It can cause bladder pain and feeling that you have to urinate often. Many people with interstitial cystitis. Now, what does PBS mean? What is that? I don't know. PBS have a hard time sleeping well, working. Oh my goodness, look at that. And enjoying a normal sex life. There's no cure for IC and PBS, but there are things you can do to relieve these symptoms. And what are some of the symptoms? Pressure or pain in your lower abdomen. The pain can range from mild to severe. It may get worse as your bladder fills up. It may feel better as you urinate. It's just, you urinate often. It says sometimes you can urinate up to 50 times in 24 hours. You have to wake up to urinate. It's a constant feeling of needing to urinate. So let me just introduce you to Christine Sullivan, and she can tell you about her experience with interstitial cystitis.
Hi, everybody.
Hello, Christine.
Hi, everybody. I am 23 years old, and as Eunice said, I do suffer from interstitial cystitis, and an easier name for that would be IC, and that stands for interstitial cystitis. So basically, she explained what it is, and yes, PBS, by the way, is painful bladder syndrome.
Okay, thank you.
Yeah. So basically, it really does affect my bladder wall. Like, it's the inflammation of the bladder wall, and it affects my pelvic area and my urethra, and it also causes lower back pain and stomach pain, and the pain can go down to your upper thighs. So you just have pretty much constant long-term pain, and right now, since there is not a real, I would say like a real good treatment for IC, everybody who has this is suffering big time. Also with IC, it's not a condition that is alone. You always have something that occurs with it. Like some people have IC and fibromyalgia, or they have IC and irritable bowel syndrome, IC and pelvic floor dysfunction. Many people suffer from depression and anxiety and just all of these different things. Some people have hysterectomies, and some people have actually gotten their bladders and their urethras taken out. So it's very vicious, and it's very hard. Very hard.
Oh, sorry. Okay, so tell me, how did you realize, how is this diagnosed? Was it diagnosed as, or how did you start experiencing it, and how did they, what was the, I'm trying to think of the progression of it, okay? So it seems like it's not an easy diagnosis, like you're taking out bladders, you're doing this, you're doing that. So what was your journey with this? How did you when did you start having these symptoms?
Basically, I really noticed, it took me to get diagnosed to notice that I was experiencing symptoms even before, years before I was diagnosed. But in the year of 2008, I did started noticing that I would go to the bathroom more often. And at that point, I didn't have pain. I just had to go to the bathroom, back and forth to the bathroom. And so I went to the doctor for stomach pain, and I also told my doctor about the my bladder and me going to the bathroom, and I thought maybe that I had overactive bladder. So they ran tests, and some people, when they go to the doctor, they get misdiagnosed with UTI, which is urinary tract infection. But in a lot of cases with IC, you get urine cultures done and you get your urine tested, yet there's no infection or bacteria that shows up. So then you're like, okay, what's going on? Because nothing is showing why I'm experiencing the pain that I'm experiencing, because IC does mocks a UTI.
Mm-hmm.
So if you ever had a UTI, you know how painful it is to
urinate,
and to, those things. So, yeah, many of the times you go in all the time, and I still do that. Like, I go in all the time and get my urine tested, and there's never an infection. Or once they did see blood in my urine, so at that time, my primary care doctor referred me to a urologist. So once I went to go see the urologist and I was explaining my symptoms and the things that were going on, he told me that he thought I had interstitial cystitis.
That's the first time you heard that?
That was the first time I heard that. I had never heard of that name. I've known about like overactive bladder, but I never heard of anything as far as interstitial cystitis until he said this. Mm-hmm. And it's odd because many of people, I was lucky to get my diagnosis like a month later after going to, see a doctor. But there are many people who go years without being diagnosed, because for me, it seems like nobody is taking it seriously. We get it. The pain is all in your head. You're just, imagining it and things like that help discourage us, and then it make us think like, are we crazy? Are we, what's going on? They can't figure out what's wrong. So it makes you think like, what have you done? Or, how could you have prevented this? And you get angry with the doctors because you're upset because you don't know why they don't know. And so many people go years undiagnosed. But in order to get diagnosed, well, at least for me, I got diagnosed by getting a cystoscopy and a bladder biopsy. And a cystoscopy is pretty much them taking a microscope and putting me under local anesthesia so I'll be asleep. And they look into my bladder and they see that my bladder is red and inflamed, and some people, they have ulcers, within their bladder, but I didn't have that. But with I don't know the correct term for it, but when they look into the bladder, they do see like holes of blood, like so. Yeah, that's how I was diagnosed, by cystoscopy and a hydrodistension, which that's a procedure where they go in and they stretch the bladder, because many of the times people with IC, they have a low capacity to hold their urine. So some people have like a really small urethral hole, so they go in and they try to stretch your bladder so it can help enable you to have a better capacity to hold urine. But we don't have a very effective treatment. Like, even with the hydrodistensions and the other treatments that I can explain that I've been through, they haven't been so much effective. And it always just depends on the person, because everybody who has IC experiences it differently. Everybody has a different story. Yes, we share similar symptoms and things like that, but everybody has their own individual story with this disease.
Like, give us an example. So we know it's painful, the burning, the frequency of urinating. What are some of the things that you think are specific to you? Because you do communicate with other sufferers of this condition, right?
Yes, I do.
Okay, so what are yours that are you think are individual to you?
Definitely the pelvic pain, the urethra pain, lower back pain. Definitely the increase in the urgency and frequency. And with interstitial cystitis, some people, and I didn't know this, I thought everybody had high urgency and frequency with it, but not a lot of, well, a lot of people do, but there are some occasions where people have it and they don't have, you know, the high urgency and frequency, they just have the pain. So that was new to me. But there are times when they get into a flare, and a flare is just when your symptoms increase and, you know, becomes more severe. They have that flare, and then the flare makes them go more. But in my situation, I go up to 40 times a day. So I suffer from the high urgency frequency, whether I'm in a flare or not, and I experience some kind of level of pain every day.
All day?
Every day, all day. The intensity increases and decreases, but I'm always in some kind of pain. Usually my pain on a scale of 1 to 10 is a level 8. Lately it has been over a level 10, so about a 12, and that's really, really, really high and bad. And since I don't have any medications to help decrease those symptoms and decrease my flare, I pretty much stay in pain. And that's very hard to do, but yeah.
You said, one of the things you said is that many people don't realize that you have IC. They think, oh, you're okay.
Yeah. It's IC is not rare, but it's not well known. Even some doctors don't even know what interstitial cystitis is. You know, sometimes I go to the emergency room and, you know, I let them know that I have a history of IC, and they don't know what to do. They don't know how to treat me, so they'll give me some
You're going there because you're in severe pain?
Yep, I go there because I'm in severe pain, or because I went to my urologist and was put on some new medication that has caused urine retention, which means that I can't pee. Oof. So I will end up in an emergency room, and I will have to get put on a urinary catheter for about a week. So they don't know what to do, so they, you know, give me this catheter and give me some Tylenol or something like that, and send me on my way and say, make a follow-up with your urologist in like 2 days. And then it's hard because my urologist, he's so busy, I can never get to him. I'm always speaking to his nurse, and it frustrates me that I don't want to speak to his nurse. I want to speak directly to my doctor, because yes, my nurse, she knows some things, but my doctor, he specializes in this. So I need the one-on-one connection with my doctor.
So it's frustrating for you to go to the doctor, to the emergency room, and also, how difficult has it been if a person doesn't have health insurance? Are there certain medications they don't have access to?
Yes, because I am one of the people who do not have health insurance, and by me living in the Champaign area, I go to Carl Hospital, and they have the community care program, and I did apply for that, and I'm grateful that I did get 100% approved, but they still have like certain qualifications. So like if I don't need it, they won't do it. So like the surgeries that I've had, I've gotten through that health care because I needed it. But if this surgery was not necessary, then they will not pay for it. And medication-wise, I can't afford the medications that I need. Like they want to put me on Neurontin, which is a seizure medication, but it also helps to treat the pain with interstitial